An online GLP-1 clinic means a clinic for weight loss injection medicines usually ordered through a website. Before you say yes, run these 5 checks: prescriber, intake, drug source, dosing, and follow-up. Fast approval may feel convenient, but cheap is not the same as safe. If a clinic cannot answer these 5 questions before payment, the problem is not price, it is risk. Online care is not automatically bad. Many online clinics make treatment look simple. You complete a form, upload basic information, pay a monthly fee, and wait for shipping. That access can help people who cannot easily find obesity care nearby. But access should never replace medical judgment. The danger is not only getting side effects. The bigger danger is getting a prescription without a real plan. If nobody asks what else you take, the visit is too thin. Screening, dosing, and medicine source matter before the first package arrives. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These GLP-1 medicines, drugs that affect appetite and blood sugar signals, are prescription medicines, not wellness shortcuts. Wegovy, Semaglutide, and Zepbound, Tirzepatide, are approved for long-term weight treatment in certain patients. That is why every online clinic should prove it is providing care, not only access. The first check is the prescriber and the medical record. You should know the clinician's name, license, and state where they can treat you. The visit should let you ask questions. The chart should show why treatment is reasonable for you. One red flag is a hidden prescriber. If the website shows only a brand name, customer service team, or vague medical board, be careful. You need a real clinician responsible for the actual prescription. The clinician should understand what could make treatment unsafe. A careful clinic may ask for prior labs, medication lists, or records from your regular doctor. That extra step can feel slow, but it helps separate real care from a shipping process. The second check is the medical intake. A serious clinic asks about pancreatitis, which means inflammation of the pancreas. It asks about gallbladder disease, kidney problems, pregnancy plans, diabetes medicines, eating disorder history, and prior weight loss surgery. These details can change the plan. The intake should ask about insulin and other diabetes medicines that can lower blood sugar too much. It should also ask about nausea, reflux, constipation, dehydration, and alcohol use. These questions decide whether the starting dose and follow-up plan are safe. A safe clinic may say no, slow down, or ask for more information. That is not failure. It means the clinic is checking whether online treatment fits your situation. Instant approval is not automatically better care. The third check is the medication source. This is where a polished website can become dangerous. The first 2 checks may look professional, while the hidden risk sits in the bottle, label, or pharmacy. Most people focus on price. They rarely ask whether the product in the box was reviewed at all. That question matters because approved drugs go through review before marketing. The Food and Drug Administration, known as the FDA, reviews safety, effectiveness, and quality. Compounded drugs are custom-made by pharmacies in specific situations. They are not FDA approved, and they are not the same as generic drugs. A lower price can mean the patient must handle more measuring, checking, and uncertainty. If the clinic cannot name the pharmacy, explain the ingredient, or show clear labeling, step back. The product should not sound identical to an approved medicine. Ask what happens if the clinic changes pharmacy, medicine strength, package type, or expiration date. A safe program explains changes before shipping and reviews the instructions again. Ask who is responsible if a shipment is delayed. A rushed program may send a different bottle and expect you to notice the difference. The fourth check is dosing. Approved pens are designed to deliver set doses. Some compounded products arrive in vials, small bottles of liquid medicine. Those may require a syringe, and the dose instructions must be exact. The clinic should explain exactly how the dose is measured. It should not send a vial with unclear instructions and leave you guessing. Syringe size, medicine strength, and dose should match clearly. Units are not the same as milligrams. That difference can cause real dosing mistakes. Before the first injection, the clinic should check that you understand the dose. It should recheck instructions if the bottle, syringe, or medicine strength changes. Once dosing is clear, the next question is, what happens when your body reacts badly? The fifth check is follow-up. The question is not whether the clinic says it monitors you. The question is whether it changes the plan when something goes wrong. Follow-up should not be a single emergency sentence buried in a portal. Nausea, vomiting, constipation, diarrhea, and reflux can happen with these drugs. More concerning symptoms include severe belly pain, repeated vomiting, dehydration, fainting, or signs of low blood sugar. The clinic should tell you who to contact. A serious program should define action thresholds. It should say when vomiting means holding the next dose. It should say when dehydration needs same-day help. It should also say when diabetes medicines may need review. Ask what records you receive, who updates your dose, and who handles side effects after hours. Also, ask whether your regular doctor can see the plan. Ask how quickly non-urgent messages are usually answered. If every question goes to an automated script, follow-up may exist on paper, but not in practice. Once follow-up is clear, review the clinic terms that can affect safety. Start with data. A weight loss intake can include photos, weight history, medication lists, and private health details. The clinic should explain secure messaging, privacy practices, and who can access your information. Then review the money terms. The advertised monthly number may not include medicine, lab work, shipping, follow-up visits, dose increases, or cancellation rules. Ask for the full monthly cost at the dose you are likely to use, not only the starter dose. If medicine and membership are billed separately, cancellation should be clear before payment. Billing pressure is a medical red flag too. Be cautious if the clinic pushes same-day payment before answering clinical questions. Be cautious if reviews look too perfect. Guaranteed results, hidden fees, and difficult cancellation rules should make you slow down. A clear refund rule also matters when medicine cannot ship on time. A clinic also needs a plan after the first prescription. Missed doses, plateaus, side effects, surgery, pregnancy plans, and stopping treatment all need answers. Those answers should connect back to real care, including what the patient must do between visits. That patient side plan should cover food, protein, strength training, sleep, and follow-up. These medicines can help, but the prescription is only one part of care. Without daily support, weight loss can happen while health support falls behind. Your decision can be simple. Say yes only when the clinic passes 5 checks: licensed prescriber, complete intake, clear drug source, clear dosing, and reachable follow-up. Then confirm it protects data, explains costs, and stays responsible after treatment starts. An online clinic should feel medical, not commercial. Trust the clinic that can say no, identify the medicine source, explain the dose, and respond when problems happen. If one answer is missing, do not treat the low price as safety. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.